Can gum recession be caused by jaw misalignment? If so, what are the possible solutions for correcting it?
All right. This is one of the most commonly asked questions, and I shouldn't say most commonly asked question. Um, it's the most unknown fact, and people say this is typically what happens in our practice. So patients go to the dentist, and then the dentist diagnoses you have gum receding. I want you to go see Dr. V, or I want you to go see Tooth HQ. So a patient comes here and we tell them, well, you do have gum receding and you got to fix this with what we call it as a gum grafting. Patients say yes, and then I kind of look at them, and then patients sometimes ask me, why are you looking at me like this? You never asked me, why you had some gum recession to begin with. Some patients do ask. Most patients, they do not even have the knowledge to ask. So I tell them, and before they even ask, and I even tell them, hey, you didn't ask me why it happened and why you need to fix that, right? The reason you need to fix that, you don't want the gum receding to continue, and you are going to end up losing the teeth. So that is the reason why you want to fix that. But can that happen because of the jaw misalignment? Absolutely. One of the most common reasons, like I tell the patient, is because either you were born with it and you had some kind of a misalignment, the tooth kind of got pushed outside a little bit and around the bone case. Now it's kind of like stretching the gum tissue, then that made the gum tissue thin, or the bone kind of pushed the bone and kind of almost pushed the gum away, like gum down. That's what would cause the gum receding. And not that because you're born with it or misalignment, it's not uncommon that might happen even during braces. The orthodontists are very good about telling the risk of getting the braces, and this is one of the most common risks. So they will tell them sometime to prevent the gum receding from happening during braces, we do the gum grafting prior to getting the braces started. Or if you happen to, or the orthodontists happen to notice any gum receding, they will send the patients to us during the braces process, and then we'll do the gum grafting, send them back to the orthodontist for them to finish up with the treatment. So to answer your question, yes, the jaw misalignment can cause the gum receding. The ways to fix that would be either the gum grafting or a combination of gum grafting and the orthodontic treatment, and then followed by that, like the long-term fix would be, you probably would need to get some kind of a bite adjustment and a night guard, so that way we can prevent this from happening. Very rarely we will combine other modalities, and one of the most common thing that we recently started doing is to combine the laser treatment at the time of the gum grafting, so we can expedite the cleaning process by controlling the bacteria.